All right, so good evening once again, and welcome to another edition of the discussion on egg donation and the possible health risk. I had discussed this last week, and unfortunately, I had to basically cut it short on that day. So I figure that we will have further discussions about it today, or, going over and reviewing the same slides that I shared the last time. So I'm going to share my slides again today and go over the topic one more time. So my name is Abiola Adewusi. I am the director of MedBan Agency that is in the space of reproductive medicine, that's fertility issues, and we offer support services that ranges from donor recruitment to surrogate recruitment, counseling, consulting, advisory, training, and so many other things that borders around support services. The topic that we're going to be talking about today basically borders around the health risk of donating more than the number of recommended times. So we're going to talk about the listed items here, and we're going to define egg donation. So basically, what exactly is egg donation? For the uninitiated, do we really does it even make sense? Egg donation, is it chicken egg? Is it what egg? Human egg? Does that even exist? And if it does, how does it work? I mean, what is it about? So egg donation is a process where a young female adult donates her eggs to a couple or another female who is not able to produce her own eggs due to age or medical conditions. So if you take a look at the diagram on the right side of the slide, you would see exactly the pictorial connotation of what egg donation is. We have a young, healthy donor on the right who magnanimously, altruistically decides to donate her eggs and give it to a couple so that the woman would be able to fertilize the donated egg with the husband's sperm to create an embryo and possibly get the woman pregnant and have a child of their own from the egg donation. Why are they needed? There's so many reasons. And how do you put smiles on couples' faces? By donating your egg for them to be able to have a baby. Any couple that is in need of having a baby usually come with all kinds of emotional baggage that can be very debilitating and depressing. So if you're able to donate your eggs, then it'll bring joy and it will complete their family. The very important thing that we need to know as egg donor is that the eggs that you don't use, if you don't get pregnant, you don't donate it, and you don't get pregnant in that cycle, the egg will go to waste. What do I mean by that? For every cycle that we ovulate, an egg or two is released from the ovarian reserve and it will never come back. So I like to say, why waste it when you can donate it? The egg donation process is quite cumbersome, and it's very important for us to know that it's a series of things that go on. It is not every young adult that comes in the interest in egg donation that is admitted. First of all, the donor has to show an indication or show interest that they want to donate. And then the donors will be thoroughly screened to make sure that they're actually able to donate or they're eligible to donate. There would be matching with the future parents. So there has to be some close profile matching similarities between the egg donor and the recipient, which is the patient. The consent form that are signed, so there are no donors. Now, donors are not used unless they consent to it. So all these processes will be described to the donor, explained to the donor, and they have informed consent to go through the process. And this egg donation cannot be done unless the donor actually consents to the procedure. So then the stimulation will be done, and then the egg retrieval will be done at a particular time that the eggs have matured. First of all, the egg donors have to be within the age of 21 and 28 years old. They have to be mentally and physically stable, no history of genetic diseases, no substance abuse, no drug abuse, and of course, they must have a very good passion for the process. So there is no amount of money that you can use to say thank you to these egg donors. The number one reason is for a good cause, altruistic reason, passion to help childless couple. I've talked about the informed consent because it is a must. If you're a prospective egg donor and you go to a clinic that does not give you consent, please run, because that means they're not doing the right thing. And of course, your feedback is very, very important when you go through the process so that the process can be improved for the future. There's so many things that is involved in preparing for as an egg donation. Your last menstrual period is very important for you to note. There may or may not be instances where you use birth control pills. Injections are definitely part of the process. You need to be comfortable with administering injections either by yourselves or by a nurse that knows how to do that, because that's what is going to be used to stimulate the ovaries. Ultrasounds are done intermittently to monitor the growth of the follicles. And when the follicles are ripe enough or big enough at the right size, then a particular injection will be given, which is called HCG, to induce ovulation. Egg retrieval is usually done under slight sedation, and it's usually an outpatient procedure, so you don't have to be cut open. Everything happens through the vagina. Once the procedure is done, you can go home the same day. What are the possible risks and side effects of egg donation? The number one most scary side effect or risk is ovarian hyperstimulation, OHSS for short. At this stage, in this age to 2023, there should be no case of OHSS again. Sometimes donors are stimulated and the ovaries hyper-respond. If a donor goes to a good clinic that is up to date with the procedures and processes of ovarian stimulation, then they should be able to anticipate and prevent OHSS. If you're a donor, a prospective donor, and you experience OHSS, please, please, please do not hesitate to mention that you have experienced this if you want to do it again, so that they can mitigate against you having similar experience. This is an experience that anybody wants to have, and it's a possible side effect of, being a donor. Sometimes bleeding can happen, infections, injury to the bladder, and blood vessel. Now, all this risk are preventable, and that's the reason I will stress, as an egg donor, be sure of where you're going to. Protect yourself. You're trying to do a favor to another couple. Do not put yourself at risk in the process. Know the clinics that are registered with the Association for Fertility and Reproductive Health. They follow the guidelines that are set to be able to protect every single patient that walks through their clinic. So all the side effects, as it were, they do happen, but they do not have to happen if you're being treated by the right physician or the right clinic that knows what they're doing. So these are all preventable side effects and risks. How many times can egg donation be done? I think I've put the answer here and everybody can see that it is 6. The global recommendation for the number of times for a donor to donate is 6, and it's a universal and global guideline followed by everybody in the world. Why not more than 6 times? Some donors say, well, I'm still young, I donate, there's nothing wrong with me, so I can do it again. I can try to help as many families as possible. Well, it's a good thing. And like I said, sometimes when you donate more than the recommended number of times, you actually expose yourself to some risk. Although statistically, there has been no proven health risk associated with egg donation to date. There have been researches, but there are none that has been pinned specifically to egg donation that, this is the reason why this is happening, because of the egg donation process. However, like I said, if you continue to do this so many times, you also expose yourself to the inadvertent consanguinity that can happen. And what does this mean? It means that you might now expose yourself to having so many children that may come back to now marry each other or cohabit with each other, which, they say if your blood is too close, it's not a good thing. So the farther away it is, the better. The minimum number of times you do it, the better. 6 is the max. Just do the 6 and, close the altruism and have your own, because I'm sure that anybody that is donating also would like to have their own. So 6 times is good, and let's follow the rules. Frequently asked questions. What will my own fertility be affected? And the answer to the question is no. As a matter of fact, if you are not careful you will be kicked into a high fertility mode. And if you're not ready to have a baby, you cannot be having intercourse without protection, because those ovaries, get excited and they stay active for a while. So it doesn't affect you negatively, it affects you actually positively. If you are in fact with a good ovarian reserve. Now, will donating my eggs make me infertile? No. The answer is no. It will not make you infertile at all. Will it reduce the number of eggs available for me? Of course. Naturally, the number of eggs we're born with reduces with age. So whether you donate or not, the number of eggs you have available, even to yourself, will reduce as you age. And this is what I tell donors. I said, it's a good thing that you're donating to this couple, but remember, don't wait until the age of this couple before you start trying. And then you say, oh, Mrs. Adewusi said it wouldn't affect my fertility, because the people that you're donating to once upon a time had very good ovarian reserve, but for whatever reason, the ovarian reserve depleted. And there are some patients that are actually born that way. They do not have much eggs in their ovarian reserve. So yes, the number of eggs will reduce as we age. If I donate, will I be able to still have children? And the answer is yes, you will be able to have your own children when you're ready to. Are there side effects? I've really dealt with this topic, so I'm not going to talk about that anymore. Will the procedure require surgery? No, it does not require any open surgery. It is just a procedure, outpatient procedure that is done to retrieve the eggs, and everything happens through the vagina. So there are no open surgeries. How many times can I donate? I think everybody that has been listening to me knows that by now, and that is 6 times. How long do I have to rest before I donate again? It depends on the school of thought. And the recommendation is that you rest for 2 to 3 months before you try it again, because obviously the process of egg donation is quite stressful, and you have to be committed to it for you to be able to do it. So I'm not sure that anybody will want to finish a cycle and then come right into it, unless there are extenuating circumstances that surrounds that. So the recommendation is 2 to 3 months of rest before you cycle again. So this is our contact. You can go to our website to get more information about what we discussed today, and you can reach out to any of our numbers listed. We're also on Instagram, YouTube to check those videos, Facebook as well. We're everywhere. Our social media handle is Medbond Agency, so you can get more information there, or you can give us a call or send us a private message. So I will take questions at this time. If there are any questions, I can take it at this time. I hope that you have found this very informative, and we hope to continue to give more information about third-party reproduction on the slide. So anyone, any questions? If you have any questions, I'll be happy to take it now, unless you're telling me that I've answered every single question that is popping in your head at the moment. Any questions? You can just go ahead and unmute and ask any questions that you may have. All right. Nobody seems to have any questions, so I guess my presentation is quite explicit and self-explanatory. So I'm going to assume that I've done justice to the topic and there are no questions at the moment. Is that true? May I hear a yes from someone? All right, so if there are no other questions other than the ones that I've answered, I think we're going to draw the curtain at this point, and I look forward to seeing you again soon on another topic for discussion. We will circulate the next topic for discussion and we will announce that, and we look forward to you joining us again on discussions like this. Thank you very much and have a wonderful evening. Bye, everyone.